We need connectedness. And we start at, well, as physicians specifically, they're trained to disconnect from what is too vulnerable, which is their emotions. They need to do really hard surgeries. They need to talk to families after devastating events have happened. There's a healthy amount that they need to disconnect in order to do their job. But the toll that that has on their connection is from themselves.
What if you could reclaim hours of free time each week, create legacy building wealth, and devote more energy to your passion projects without giving up on your career as a life-saving MD? Dr. Vikram Raya is a functional cardiologist, high-performance coach, and real estate expert, is here to give you the tools, strategies, and solutions you need to transform your life, unlock your limitless potential, and achieve greatness, all while freeing up your precious time. Welcome to Limitless MD. Let's dive in.
All right, guys, welcome back to another episode of Limitless MD. I have my good friend and guest, Erika Czerwinski. She is a clinical psychologist that's going beyond and going to the next level and helping physicians really achieve from burnout to well-being. And she has a very unique strategy which she honed during COVID, which is involving psychedelics and creating psychotherapy and creating these amazing breakthroughs where people can go from being excellent at work and then tanking in their personal life to becoming all around a 10x human being and individual. So, Erika, welcome to the show.
Thank you, Vic. I'm so glad to be here.
Absolutely, absolutely. So it's amazing. You know, we were connected through a mutual friend, and we've been chatting about how Eleos, your company, is really on a mission to, change physician lives. And I was sharing with you how Limitless MD is also on a mission to help change physician lives. And so I thought, what better way than to bring both of us together on the podcast and chat about that?
Yeah, I love that. I think coming from two different angles, but to create more well-being and balance, right? I think a lot of it, one of the things that I love that you said was that health and energy you possess is your highest currency. And I think that directly speaks to a lot of what we focus on at Eleos, especially for physicians that are focused on other people's health and well-being.
So tell me, the name Eleos, I like that. Is it Greek, and what does it mean?
Yeah, it is. And she is the Greek goddess of compassion and mercy. And her parents, which I also really like, come from the father of darkness and the mother of night. And so I really like the thought of how from darkness, we really can cultivate and bring in and see our hearts and come into compassion.
So you've been in the psychotherapy space for almost 20 years, traumatic healings, different conditions you've been helping people get through, PTSD, things like that. Last 10 years, you've been working with physicians. How did you get into that space?
When I've been working a lot with really severely struggling young adults and families and parents. And when I opened my private practice, I was having a lot of high achieving individuals come in as my clients and patients. And many of them happened to be physicians. And so from there, I started seeing the commonalities and of these people that had such competencies and incredible gifts, and often coming into this world wanting to be healers and then meandering through their careers and really getting so split and separated from their hearts and connection to their own feelings and clarity and well-being.
Interestingly enough, you started recognizing patterns, right? Like you saw, okay, physician number one, physician number two, physician, oh my God, they all have the same variation of a challenge. And then so you started developing more specialized therapies and treatments for them, or at least guidelines of how you would take a physician through a process.
Yeah, and with Eleos, what we really do, one of the things that I see, well, a couple of main things with physicians particularly, is that they're so really good at masking and they're so really good at needing to perform that they disconnect from even what their own truth is, what they feel, what their own clarity is. And so I was really having physicians come in and be so high functioning, but not really know how to connect to what's underneath everything else that they're doing and they're functioning, but what's really connecting them inside. So that was impacting their relationships and especially with the people that are most important, their children, their partners, and their social lives, which most of them didn't have any.
So,
So,
so bottom line is, they learn to compartmentalize, use the word masking, where the inner pain never seeped into their professional work. And so they're able to get by and even high function
yeah.
in these roles of surgeons and physicians and internal medicine doctors and whatever other type of physician they are. Uh, so the inner ecosystem was decaying, if you will, and there's no awareness, there's no red flag, there's no, I guess, canary in the yellow cage that would help warn us that something is going on. For those guys who are listening out there, can you describe some of the warning signs of
Yeah.
how perhaps they're not burnt out, or they're on the way to being burnt out, or there's some moral injury to these physicians?
Yeah, one of the, for instance, I had a patient come in the other day, and one of the after the first 15 minutes, they just mentioned, "Oh yeah, their dog passed," and I paused because if anybody out there has an animal, when our animals pass, it's important, and they kind of just dropped it and went on, and I was like, "Whoa, whoa, whoa!" They were so disconnected from any internal state, any feeling state. So I think one of the flags is really noticing that there's such a default mode to disconnecting from emotions, feeling lack of motivation for things that you used to feel motivated for. Also, things that used to be or are usually easy to do that seem like you have no energy to do them. Everything from, like, for me, I know that I'm feeling more burned out or drained when I don't open my snail mail, like when my mail just sits and stacks. Things that should be easy, or answering the emails that should be easy. Things that are normal every day, but seem you just can't get through it. That's another a big sign that you're starting to fry a little bit.
So what you're describing is almost like a zombie state. They've become increasingly numb,
Mhm.
and the apathy, the lack of any kind of true affect, it's and yet they're still able to perform. And because physicians are such a unique breed of individuals where they can compartmentalize, it takes longer than other people out there who they when they degrade, like everything starts falling apart. And so you get that awareness pretty quickly.
Yeah, and they're also really good at performing. So they're really good at getting things done. Right? You know, the busiest person in the room, you hand the thing to it, they're going to get it done often. Right? They're really good at doing lots of things and functioning. But what gets compromised is their connection to themselves. Their main part is connecting to themselves. Whoa, what am I really wanting? That I'm not feeling happy. I'm not feeling joy. A big complaint that I got is that I don't even know when the last time I felt joy was
Mm.
having fun. So they're so good at performing. They'll go through the motions of doing the thing or even going on a date night, but it's not fun for them. They're worried about making sure the other person is okay, but that creates a huge disconnect to what brings connection and happiness is that synergy and the attunement. They can't really attune because they can't connect to themselves. And you can't attune if you're not connected to yourself.
So it sounds like they're going through the motions of life, but they're not living life fully.
Yeah.
And it's almost like, when I'm like, I had to do a climb recently, and we're climbing Rainier next week. And one of the training mountains is near my house here in Shenandoah Valley. And it was a brutal hike. It's a 14-mile hike. And, my kids, it was the first time I got them on. So they were excited, they were running around. But I was carrying my, like, heavy backpack just to practice. And my only thought process was, how do I get through this? And I didn't, like, my goal was just to endure it. But then I would remind myself, hey, let me enjoy the surroundings, let me enjoy that forest. But it was so physically draining that I was like, I get a sense that these physicians are just muscling their way through life. And since we self-select physicians because physicians have to have a concept called delayed gratification. And because they're really good at this delayed gratification, they're willing to keep sacrificing that, forever. And so
Yeah.
it what we rewarded them for at the beginning is their undoing now.
Yeah, and I like to distinguish this between the difference between endurance and resilience.
Mm.
Because endurance is what you have, you can rock up that mountain and you get a grit, and you're really good at that. You can, physicians are triathletes and endurance runners. Like you could do physical pain. We can do that. The thing that is harder is what's the difference between endurance and resilience. And the difference is a regulated nervous system.
Wow. Say that again. That was good.
Okay. The difference between endurance and chugging through something, which often requires dissociation and disconnecting from pain, and resilience, which means a regulated nervous system.
Mm.
So we can regulate.
Yeah, go ahead.
So we can regulate through various techniques, but it requires us to be present. So when you were chugging up and like kind of disconnecting and just focusing on the goal, and sometimes we need to have endurance, right? I'm not saying endurance is a bad thing, but when we're constantly relying on dissociative like tendencies and coping skills, then we're not connecting to our bodies. If we're not connecting to our bodies, we're more apt to get dysregulated. And on one hand, a dysregulation can be on the over excitatory network, which is okay, we're in more of the fight or flight mode, we're going into action, or on the under activation side is dissociation.
Mm-hmm. So how do you take this and put into practice? How do you take the doctors who come to you? First, is there like a diagnostic tool you use to evaluate where they are in this spectrum of super happy, high well-being to completely burnt out, ready to quit, and somewhere in between? And then, I'm sure anxiety, depression, suicide also hangs around in these corners. And then it's obviously there's medications, there's, cognitive therapies, and there's something you've created, innovated, which is using psychedelics to fast track, enhance, bypass certain strategies and go quickly to a result. So maybe we'll talk about the results in a second, but let's talk about the diagnostics first.
Yeah, so there are definite scales that I use. The few that you've named, like I'll use a depression scale, I'll use an anxiety scale. Also, there's another scale that came out through one Rosalind Watts called the connectedness scale, and that looks at. I really like that one. It's a newer measure, but I like it because it's speaking about how do we feel connected to ourselves, how much do we feel connected to our other close relationships and the world in general. And then she's added nature. And the reason why I love that piece is because what we're finding in the research around what helps people restore, if you were just to poll 10 of your friends, the majority, of their top 3 things that help, one of those 3 things is going to be nature. And so as a scientific field, we want to find other empirically validated elements of I can reduce my depression, I can reduce my anxiety. But what does connectedness mean? And as humans, we're beings who are wired for connection. And so from the very first moment we're born, we need that other human resonance to help us regulate. And we need connectedness. And we start as physicians specifically, they're trained to disconnect from what is too vulnerable, which is their emotions. They need to do really hard surgeries. They need to talk to families after devastating events have happened. There's a healthy amount that they need to disconnect in order to do their job. But the toll that has on their connection is from themselves. If they don't start there, they're not going to have true connectedness with their partners and their children, and in general, feeling connected to nature, which is so inspiring and a nourishing element for us.
Okay, so we do the scales, you get an assessment, you obviously talk to them, you have your own questionnaire, you get a sense of what's going on. Let's say someone's, they're definitely not well in terms of where they need to be, but they're not severely depressed, but they're just not happy with life. They're not fulfilled. Walk me through a pathway or strategy for those guys.
Totally. Usually what I think the people that come to Eleos are those who they know something is not right. They're almost even at a brink of, I need to make a change. I have no clue what that's going to be. I don't even know what it might look like, but it just it's starting to feel slightly unbearable. I'm kind of, in this endurance state, but I know it would be really nice if something could shift. But they do have an awareness of that, and they're starting to seek outward, which then they come to us, and it's, we're like, we'll create a really safe, sacred space. It's confidential. Your work does not get reported to anybody else. Like, it is a small container. We operate with a max of 12 people. So you're not going to be in a big room with lots of, we also provide CMEs. That's another cool thing about our program. So they can get 20 AMA CMEs for doing our program. And on top of that, we really work to do a little education before, so they could drop in and be with themselves and each other in a closed, beautiful sanctuary space at a retreat center that's having a lot of outdoor space. And so we start to go back a little bit to your question, we start with a process of inquiry. And that's a little bit, it's a one-on-one session that they get with me, and that we really dive in a little bit into, you don't have to think specifically why you're here, but through our conversation, we'll start to get these seeds. And those seeds start to grow into little seedlings of intention. And so by the time they get to the retreat itself, which is a 4.5-day retreat, that we're prepping them for the group work and for their ketamine journeys. So we're going to be doing ketamine-assisted therapy.
Let's talk about ketamine.
Yeah.
It was considered a fringe element for many years. In the last 5 years, it's caught on. And now in the last few years, it's become more of a biohacking thing, and people are starting to use it for multiple uses beyond what it was originally known for. Can you just give us and the listeners just a background on ketamine in general?
Sure, yeah. And I think a lot of physicians, when they first hear, ooh, ketamine therapy, that's an anesthetic. I only use that for my patients. That's scary. Is that a drug? Is this going to be reported? I don't want anything that's going on my record that looks like I'm doing something lascivious. Like, what is this? And so really, I mean, it's, as many people know as physicians, it's one of the safest, and it's anesthetics, and it's what makes it a good entrance into the psychedelic world, is that it's very short acting. So your journeys are really a 45-minute peak, and we can create a space where you'll be in that realm for about 2 hours from start to, from initiating.
But before you go into how you're using it,
Yes.
I really want you to lay out the background. So it was anesthetic. It's used in
So
traditional.
yeah, in the 60s, it was devised.
Yeah.
It came on when they were looking to devise an anesthetic. And what they first came up with, they found that there were these side effects of aggression and psychotic features, and that was PCP. And so they changed a few of the chemicals, and it ended up becoming a much safer and less psychedelic element of an anesthetic, which was ketamine. They started using it in Vietnam. From there, moving forward, they started noticing that people were reporting that they were having depression remit. They were having other elements that were feeling good that was a side effect. And so they started doing studies in the 90s. Yale really launched major studies in depression. And then they had the first, that was 92. And then the FDA approved it in 2019 as a treatment for depression. So that's the really short.
Okay, so that's the evolution. So now it's a legitimized treatment. It's used as anesthetic. Now it's a legitimized treatment for depression, and it's IV administered.
Well, there's 4 main modalities for administering ketamine. The FDA approved modality is a nasal spray, and that's Spravato patent. Okay. It's patented. Off label, we also use it. And so we can use that as an intramuscular, an IV, subcutaneous, oral. So you can do a swish or a troche or a lozenge that will dissolve in your mouth.
Okay.
You can also they also make suppositories for anal or vaginal. Those are less common. Okay. And then also intranasal nasal spray.
Okay.
So those are.
So there's multiple options. I remember I was working with a psychiatrist who had a ketamine, who was adding to his psychiatric clinic a ketamine component to his clinic in Texas, and he was providing that for his depression patients, and he found it to be much more effective than the other stuff he was doing for depression.
Yeah, and there's so much research right now on psychedelics in general, but one of the main takeaways, if I had to synthesize, like what's so good about psychedelic therapy and why ketamine, the ketamine is incredibly safe. It has a short acting time period. So most psychedelics are ranging anywhere between 5 hours to up to 48 hours. And with ketamine, you're really 2 hours in the office. So it's a short acting, safe
Okay.
medicine. But the other part about psychedelics is they're finding that it opens these critical window periods.
So when
And
you
so,
mean opening windows and what does that mean? Is that is it a brain wave or brain activity that you're opening, or what's happening there?
yeah, so when we refer to critical window period in development, say, for instance, in across as you've had children across the lifespan, they're really ripe for learning certain things, right? You might remember like languages really implant like they're like, oh, between 7 and 11, like that's when you should start teaching them another language. Or where you notice where they're picking up things, in that 2-year-old period, they're really getting into the autonomy phase. So there are different phases. There are critical windows where the brain is actually very ripe for learning something. Most of those close throughout our 20s, right? We're not really having opportunities to have ripeness for learning, although we continue to learn, not in the same way that pairs with brain development. What we're noting with what's happening with psychedelic therapies is that there is actually a neuroplasticity that starts to open. And that neuroplasticity means that we are more fluid and flexible to learn things. And with the neuroplasticity, we're also noticing there's neurogenesis. So pairing these two aspects where we have more flexibility. And this is where I think there's a difference between traditional psychotropic medications, like if you're on Zoloft or having a med that works well. But what we're seeing here is that there's this acute time period where there's more mental flexibility. So the default mode network of how we do things starts to soften. And we can start to try things that are usually a little harder to try and have a little bit easier time with it. So in onboarding new patterns. And so for some of our physicians, it might be, oh, wow, it is a little less intense to maybe talk about these feelings. I
Okay.
have a grander ketamine specifically is really good at it's called a dissociative psychedelic because it separates one from the egoic sense of self a little bit. So it's almost like you can see above and you can see yourself and your life. And there's a little bit of a distance. I will say
You
that,
get a little bit of the 30,000-foot view. You get a little bit of the awareness for some blind spots, perhaps.
yeah, that it's less connected to that subjective state of, I got to do this, I got to do that, I'm scared of this, and the unconscious stuff.
Mm.
So all psychedelics do that. What ketamine does specifically is a little different is that it really does have a softening of this subjective stance. And I think all psychedelics do various things, but being a dissociative, not in the classic dissociative sense that we were talking earlier, but it's a separating out of oneself. So people
So,
often,
Erica, let's say, people who've been through your program at Eleos, uh, give me an example. You don't have to obviously tell the name of the person, but like give an example of what they were struggling with
mm.
or what were the challenges, and then maybe after the question, the coaching, the questions, the counseling, and then obviously the therapy. How do they come out on the other side?
I had one physician who he came into the program really curious, like very science minded, just like, I'm curious. I'm going to do this as an experience. I don't really think I have much to work on, but I'm just really curious about this. And he came in, and what he did do, though, was he said, if I'm going to do this, I'm going to be open to experiencing it. And on his first journey, so we call the ketamine experiences journeys, he was so profoundly he had never had psychedelics before. I think he might have tried it in his 20s at some point, one journey a long time ago. And he felt his own pain for the first time. Like he just had such grief and sadness come up. And he was just crying. And he was like, where's this coming from after? He was like, wow. And it was this big release of him connecting to his own unhappiness and his connecting to his own sadness that he was missing his children grow up because he wasn't there.
Wow.
And
And he had put such a tight lid on those emotions, and the therapy just opened it all up.
yeah, and there's something to be said for having the what we call the set and the setting and the preparation to be able to do that safely
Mhm.
and to do that in a way that's not going to be too disorganizing for someone or to feel safe enough to do that. He did that work.
Mhm.
And um, so going through that process after he returned, he really, and I often, I'm using this example, but he ended up completely changing jobs after. He stayed in the medical field.
Right.
But when we checked in about 8 months later, he's like, I did it and I had to change. I just wasn't happy. So there was some catharsis of connecting to his deeper feelings, but he was able to, you're talking about earlier doing the risky thing, or, how do you really took a risk and said, I can't miss my children like this. I have to have more of a regular hours to be home and see them during this phase of life.
Yeah. You're talking about how you help physicians, who are a certain way outside as physicians, but their personal life is being tanked or is unsuccessful because what makes them successful in medicine, which is put your guard up, work through the motions, follow patterns and not empathize too much because that can really mess with your inner workings. Is the exact opposite of what needs to be a good father, a good husband, a good spouse, a good friend, to grieve at someone's wedding. I mean, I grieve at someone's funeral. And so, as you know, in Limitless, we're taking doctors who are really good doctors, and then they're unfulfilled. Again, there's probably some disassociation, some psychological distress, and for whatever reason, they become aware of it, and now both of us are giving them vehicles in which they can express who they really want to be, a pathway to fulfillment for their soul or for their subconscious even, and then they can now go pursue that. And it's not the safe route, which is what medicine usually promotes, but it's the authentic route, which allows them to be their true self.
Yeah. And I wonder if you find this, I'm curious how with your cohort, if you find this, I think what I have found, what was hands down the most surprising thing to me after um, this last group completed was they were like the best thing that they came away with. And I was like, what's going to be best thing? Was the community.
Hmm.
They were like, I did not expect to come away with community, but being vulnerable and connecting and saying the things that they never say within hospital walls or the clinic and needing to say, they didn't even know they needed to say these things or talk about themselves. They were like, oh my God, this is nourishing. And so part in the program is they can continue on and have weekly groups with the same cohort. But I wonder if you found like, what are some of the things that supports them in taking the risks?
Yeah, what I've distilled it down to after doing this for almost 5 years now is finding philosophically aligned brothers and sisters in the journey. Right? It's like they get them because they're also physicians, but they think differently than the vast majority of physicians out there who are very certain type of personality. And these people have done the inner work to where instead of competitive, they're collaborative. Instead of like challenging them, they're encouraging them. And it's like, and they're using each other as heroes that they can exemplify and follow. And it's so rewarding. And so people, quote unquote, come for the coaching because of me or for my coaches or the material, but they stay for the community. And I think that probably happens for you as well. So there's a power. You could do this as solo retreats or solo experiences for folks, but I think you chose well by creating a community approach to it.
Yeah, I think it's one of the most powerful thing that we've gotten away from just as humans is we've become more individual and more insular, especially with docs. Like they're just insular. And yeah, being able to have connection is huge.
So, Erica, there are a lot of doctors out there who are interested or curious, and let's say they don't have even an ounce of depression, but they're into biohacking, they're into human optimization, as I am, and they want to know like what's the next level I can unlock. I've had a good friend and mentor who went down to Costa Rica or somewhere and did the ayahuasca ceremony, and it allowed him to have that next level of insight for his company, and his company took off after that, and different doctors, different things, and we have had some fellow colleagues that have done these aha moments after a major shift in their life of rediscovering their path, if you will.
Yeah.
What's what's the recommendation to these individuals who are high performers, highly successful, and they've hit sort of a plateau in life and they're wondering what's next? And does this psychoactive medications, these psychedelic uh, experiences, would that help them perhaps find a different version of themselves, the next version of themselves, or their true version of themselves?
There's a couple answers I could have to that. But yes, so what I see psychedelics do is help expand our consciousness. It helps us have a grander and broader perspective. So yeah, that's going to help see the things we're not seeing or gain perspective that we're not having from this ego state of where we may dwell on a daily basis. However, I think the power of the group and what we know of just human development is we need to be witnessed, we need to be seen when we're in authentic states. And so that's partly what a power of a group is small group that's safe. So being able to have the augmentation of the ketamine and the psychedelics expands consciousness. And then that's not really the stick, right? It's like that'll give you a great experience, but what are you going to do with it? How is it going to have a lasting sense of change? And that's a really important thing when doing psychedelics, because someone can go off and have you know, a fun time, but is there anything that they're actually taking, extrapolating from that and seeding and then sprouting and then watering, right? And so that process is essential. So yeah, ketamine and other psychedelics are going to help you expand and possibly see things. And then how are you going to be seen? And how are you giving back to others too?
The key really is having a structured approach, doing the prep or the pre-work beforehand, fully being quote unquote open to the experience and being curious, and because you don't know what will come through, but it's great that things do open up. And then finally learning to process that with probably an expert or a therapist or a guide or some sort. And then taking all of those insights and distinctions and ideas and perhaps new ways of being, and then acting on that in the future for income, impact, results, life-changing momentum, whatever that is that you're looking for.
Yeah, shift.
Yeah.
Because a lot of times they come in and they don't even know you don't have to know what the shift needs to be.
Yeah,
It's just well,
the shift needs to happen. And in that case of that doctor you mentioned, the shift was, hey, I need to be there for my kids.
mhm.
Yeah. Okay.
Family. Yeah. Yeah.
Yeah. That's great. So give me the top two or three people that really influence you in life nowadays. So who are mentors, or who are people that you follow, uh, or what's next to your bedstand in terms of books and stuff?
Yeah. I mean, I think some of my main teachers have been my in-person teachers, like mentors of mine,
Yeah.
spiritual mentors, as well as professors and clinical mentors and people that I've experienced things with. I've had one of my rites of passage teachers, who's Cater Brown, and his teacher was Malidoma Somé. So some of those lineages from rites of passage work. Then also have had other contemplative and spiritual teachers from everything from Vipassana-based meditations to um, practitioners that were in Thailand, and then
Oh, wow.
clinically theorists, everything. I mean, I have from D.W. Winnicott, beyond. These are contemporary psychoanalytic writers who were also into
So
mysticism.
it's not that you don't have any. If you have too many, you have a lot of them, which is awesome. That's awesome. That's great. We were giving you a year of ad space in Times Square. What's the message you want to give to the world?
Oh, well, for to speak from my heart, but although it may sound cheesy, it's if we can connect to what is incredibly real and authentic and lights us up inside, and unabashedly share that to be in service to our own blueprint. So how do we get connected with our hearts and unabashedly let that shine and show up in ways that really are aligned with what lights us up, and to be in connection with people and do the things that inspire creativity and bring us consciousness and connection and joy.
That's awesome. I don't know if it'll fit on the billboard, but I love it. But
I'll have to work on my
Yeah.
synthesized pitch.
Yeah. Erika, this has been a remarkable conversation. You're doing some amazing work with physicians out there. If people want to get in touch with you, what's the best way?
You could go to the website, which is Eleos Journey, ELEOS Journey.com, and you could find me there. You could also reach out by email at info@eleosjourney.com. If any of your listeners are interested in Eleos, I'm happy to offer $500 off, so they can just let us know the code Limitless MD, and then we'll take care of them.
Guys, that you've heard it here, Limitless MD discount code. It'll be in the show notes. So if you ever want to do one of Erika's programs in Eleos, use the Limitless MD discount and you'll get the $500 off. Thank you again, Erika. And guys, until next time, I really appreciate you guys supporting the YouTube and the podcast and all the growth we've had. Keep watching out. We'll have a lot more new episodes coming up. And until next time, be phenomenal.
Thank you so much for listening to this episode of Limitless MD. If you found value from this episode, I encourage you to share this episode with a friend and let me know by leaving a review. For more information, make sure you check out the links in the show notes below or simply visit vikramraya.com. Until next time, be phenomenal.